Do you think you need an hour at the gym every day to protect your heart? What if I told you that 1 minute of intense exercise, done a few times a day, can help reduce the risk of heart attack, stroke, and even cancer? It sounds like an exaggeration, but it's not. Studies published in Nature in 2022 showed that small bursts of intensity throughout the day, what we call VILP, were associated with a reduced risk of heart attack and stroke by up to 50% in sedentary people. And more recently, data released in Nature in 2025 showed something even more impactful. Vigorous physical activity in just a few minutes a day is associated with a reduction in cancer risk of about 40%. We're not talking about a marathon, we're talking about climbing stairs intensely, walking fast for 60 seconds, doing squats after lunch. These lightning bursts of exercise activate powerful glucose control mechanisms, improve insulin sensitivity, reduce inflammation, and improve endothelial function and cardiovascular health. In other words, quick and effective exercise can be a real tool for preventing chronic diseases. And in today's video, I'm going to show you exactly that, what VILP is and why it works, how to apply it even if you don't have time, and the mistake that might be sabotaging your health without you realizing it. VILPA stands for Vigorous Intermittent Lifestyle Physical Activity. Translated, vigorous physical activity done in small bursts during the day. It's not a formal workout, it's not the gym, it's not structured HIIT. It's intensity integrated into real life. It's about turning ordinary moments into powerful metabolic stimuli. You know when you run up the stairs because you're late, or cross the street at an accelerated pace, or carry something heavy with real effort? This generates bursts of intensity, and these bursts activate physiological pathways very similar to those of HIIT. When you make an intense effort for 30 to 60 seconds, the body enters a state of metabolic alert, increases oxygen consumption, activates fast muscle fibers, stimulates mitochondrial production, and generates the famous EPOC, that energy expenditure that continues even after you've stopped. But the most interesting thing isn't the calorie burn itself, it's the impact on cardiovascular health, the improvement in endothelial function, the reduction in systemic inflammation, and insulin sensitivity. This means helping to prevent heart attacks, prevent strokes, improve glucose control, and reduce the risk of type 2 diabetes. And when these mechanisms improve, the risk of chronic diseases starts to drop. Now, here's the part that almost no one talks about. The benefits didn't come from people who are athletes. They came from sedentary people who started adding a few minutes of vigorous physical activity to their day. Ordinary people, folks who said they didn't have the time. And if small bursts can already trigger these responses, what exactly happens inside the cells to lower cardiovascular risk and even reduce the risk of cancer? That's what I'm going to show you. When you do a burst of intense exercise, even for just 40 to 60 seconds, your body enters an immediate adaptation mode. The heart speeds up, blood flow increases, vessels dilate, and the endothelium starts working better. This improves endothelial function, which is one of the pillars of cardiovascular health. And when the endothelium works well, you reduce cardiovascular risk in a concrete way. We're talking about protecting against plaques, arterial stiffness, and acute events. That's how exercise helps prevent heart attacks and prevent strokes. But it doesn't stop there. In the muscle, these peaks activate a powerful molecular cascade, increasing AMPK, boosting glucose uptake, and improving insulin sensitivity. This means better glucose control, less insulin resistance, and a lower risk of developing type 2 diabetes. It's post-meal exercise, acting as a metabolic medicine. Now, here's the most surprising part. These intense stimuli help reduce low-grade chronic inflammation, improve immune surveillance, and foster a metabolic environment less prone to disease development. This is where recent data comes in, showing a reduction in cardiovascular risk of around 40% associated with just a few minutes of vigorous physical activity a day. This isn't a miracle, it's pure biology. And if you think this only works for people who are already fit, you'll see now why the biggest benefit actually shows up in those who are sedentary. The biggest impact wasn't seen in athletes, it was in people who were completely sedentary. People who did zero structured exercise, but started adding vigorous physical activity for just a few minutes a day. When you go from absolute zero to some intense stimulus, the body responds exponentially. The improvement in endothelial function happens fast. Insulin sensitivity improves quickly, and inflammation starts to drop. This is the effect of going from the couch to movement. In sedentary people, 3 to 4 daily episodes of 30 to 60 seconds have already shown an association with a significant reduction in cardiovascular risk, reaching numbers close to a 50% reduction in the risk of heart attack and stroke in the most active groups within the VILPA pattern, and the association with a 40% reduction in cancer risk in Nature 2025 in recent analyses. You don't need to become an athlete, you just need to get moving. And now comes the practical part. How to apply this in real life, even if you work all day long. You won't need to set aside an hour. You'll use moments that already exist in your day. Climbing stairs at an intense pace, walking very fast for 60 seconds, doing squats after lunch. These are what we call exercise snacks. Intensity matters more than duration. Heavy breathing, racing heart, real effort. Spread this throughout the day. 3 to 5 intensity peaks, 30 to 60 seconds each, totaling just a few minutes of vigorous activity per day. If you do this after a meal, you improve insulin sensitivity, reduce blood sugar spikes, and help prevent type 2 diabetes. But be careful, there's a common mistake that can sabotage everything. Intensity is not recklessness. If you've been sedentary for years or have major risk factors, start gradually. The mistake is trying to make up for years of inactivity in 1 week. Another mistake is doing one intense minute and then spending 10 hours completely still. The ideal is to combine less fitting time, intensity bursts, and distributed movement. That's because the benefits come with consistency, not with the excitement of a single week. That's what a habit is. And now I want you to leave a comment. So, how much exercise do you do a day? Leave a like, subscribe to the channel, and see you next time.